Hello, this is Joshua McKinnon. I'm a doctorate in nursing practice and APRN, and I will be talking about COVID-19 overview and terminology. So COVID-19 is also known as, it's a coronavirus disease. It first appeared in 2019. It's also known by other names such as novel coronavirus, also SARS-CoV-2. It's part of a family of viruses such as SARS and MERS. So SARS stands for the Sudden Acute Respiratory Syndrome. MERS was the Middle Eastern Respiratory Syndrome. And so coronavirus is a type of this same family. It's Sudden Acute Respiratory Syndrome, coronavirus 2. It's the second one of the SARS. Most coronaviruses cause mild to moderate upper respiratory tract symptoms that kind of are very similar to the common cold. There are multiple variants of this. There's some terminology that we will go over later, talking about the different variants and what they mean. The symptoms of COVID-19, as you can see on this list, mimic a lot of the common cold symptoms, flu symptoms, and even allergy symptoms. I want to point out the most notable one, especially something new to this particular virus, is the new loss of taste or smell. That was something new to the novel coronavirus. So you can get fever, chills, cough, shortness of breath, fatigue, muscle, body aches, headache, sore throat, congestion, runny nose, nausea, vomiting, and diarrhea. And then, of course, the special symptoms to this virus is the new loss of taste or smell. Some emergency warning signs for those who get really sick with this virus. They could have trouble breathing, persistent pain or pressure in their chest, confusion, inability to wake or stay awake, bluish lips or face. A lot of these symptoms are due to the body not getting enough oxygen. And so that's why their lips turn blue, or they're incapable of waking up or staying awake, or they get confused because their body and their brain is not getting enough oxygen. The high-risk populations are particularly at risk for these warning signs, and these are adults that are older than 65 years old, people with chronic conditions that can be of any age, and people who are ineligible for the vaccine. COVID-19 terminology. You'll have a list of these terminology terms in your handouts. It has the full definition of each of these terms. I just want to hone in on a couple of these differences. So, quarantine and isolation. These are very similar. They're treated very similar. There's just a simple difference in the definition. So, quarantine is for someone who does not have symptoms of the virus. They have not tested positive for the virus, but they might have been exposed to someone that was positive. So we quarantine those people. Isolation is for those who have tested positive for the virus and they might be showing symptoms of the virus. They're both treated the same. Both quarantine and isolation is being separate from others for 5 days and then wearing a mask for another 5 days when in the public. The only difference is if you have the virus, if you don't have the virus. Social distancing, we've all heard several times that it's staying 6 feet away from people to help prevent the spread of the virus. An epidemic and a pandemic, very similar as well. Epidemic is more of a localized outbreak of the virus, while a pandemic is global. That means it's gone across different countries. It's been heightened by the World Health Organization, which indicates to different countries and governments that they need to keep a close eye on this and start treating it with urgency. Flattening the curve is something that we heard early on in the pandemic. That is essentially trying to reduce how many people get infected by the virus so that the healthcare systems can treat those that are sick with it. It helps with staffing, it helps with supplies to keep those numbers low so that the healthcare systems can work efficiently over a longer period of time rather than getting hit all at once and then not being able to treat many people just based on staffing and supply shortages. Mutation is when the virus changes. So the more people that get this virus, the more chances of it to mutate. That leads into different variants. As it mutates, it becomes a different variant. And those variants can have different properties, essentially. Some of the more recent ones we've heard of are Delta and Omicron. Delta was more deadly, while Omicron was more transmissible. That means more people got it, but it wasn't quite as deadly. The numbers still stayed about the same with both, just because one's more deadly, but less people got it. One, more people got it, less people died in proportion to that, but since more people had it, it still infected a lot more people and got the people that have severe reactions to it had poor outcomes from that. Herd immunity and natural immunity. I would like to talk about natural immunity first. Natural immunity is the immunity that your body develops whenever it is exposed to the virus itself. Your body builds up antibodies whenever it's exposed to the virus, and so it builds a natural immunity. There's also acquired immunity that happens more when it can happen to babies. They acquire immunity from their mothers, whether that's while the mother is pregnant or while breastfeeding. And herd immunity is the concept of a high proportion of individuals who are resistant to this particular virus. Most of that is achieved through vaccination. And the idea is that if enough people are immune to the virus, then it protects those that are also either unable of getting the vaccine, might have comorbidities. The herd immunity, the current number is we want 70% of the population. If we get 70% of the population immune to the virus, and then there's so little people left over to get infected that those other 30% have very little chance of getting infected by it as well. So that's herd immunity. You get enough people immune to it, and the rest will also be protected. Thank you. Now,
Yeah.